before. So, sir has been spearheading the battle against COVID-19 in India, and we have been listening to him for almost every day. The guidelines are changing every day. This is really a challenging situation, sir. And how do you maintain the coordination between center and states? As our country has a federal structure, health is a state subject, and establish and maintain international dialogues between India and other countries, and maintain watchfulness, and finally feed our Honorable Prime Minister of India.
Thank you very much for the opportunity. Good afternoon, everybody, and I'm honored to be here with colleagues from countries across the globe. And thank you, Director PGI and colleagues at PGI for creating this opportunity, and thanks to the Ministry of External Affairs. What you have asked is how country at the macro level, at the policy macro level, is responding to this pandemic in our country. Let me say there are a couple of systems that are operating. One at the highest level of the government. Then there are science interfaces that we have created. So let me dwell on both, more so for the latter. But I would say that the response, because we are a federal country, ultimately the work is implemented, actions are implemented by the state governments, and even more so by the local administration at the district and the city level. We do know that the pandemic scope in India is largely urban, and that also confined to a limited number of cities. Almost 2/3 of our cases are confined to just about 11 cities. It has been so city specific. So the way it works is that the coordination is provided at the Ministry of Health level, at the level of the administrators through the principal secretaries, where the video conferences are held, guidelines are shared, so there's a technical interface, there's an administrative interface, and the Honorable Health Minister speaks almost on a daily basis to different health ministers. So that's one interface. Then there is a interface at the level of the Cabinet Secretary, who's the head of our administration and bureaucracy in the country, with the Chief Secretaries. And there are video conferences at least twice a week, if not more often than that as required. And the Government of India has constituted, for the response, 11 empowered groups, which are cross-cutting in terms of their participation from different ministries. For example, there is one that I head, which relates to emergency response and preparedness. And here I have participation from the disaster management group, the Prime Minister's office, the Ministry of Health, and so on. Likewise, there is one on supplies, there is one on communication, one on relief, one on grievances, and so on and so forth. So that's how the cross-cutting teams have been created, representing more than one ministry. That's one set of structures that are functioning. And through that, the ideas are discussed, ideas are crystallized, a response is created. And these, because they are empowered, they also are responsible for making sure that the implementation happens. So the ministry level, and the cabinet secretary level, and this is the cross-cutting level across the ministries to perform targeted functions critical to the containment of COVID-19. And then, of course, there is the Prime Minister's office, which coordinates all the activities. So this is one level. The other level of our response relates to the science and technology and best practices paradigm. And there are three structures that we can talk about. There is one called Joint JMG, Joint Management Group, which looks at guidelines, which looks at technical guidelines, and this is intra-ministerial system with participation of experts. Then in the Indian Council of Medical Research, there is a national task force on COVID-19, which is primarily for evidence for clinical testing issues, clinical issues, epidemiology, operations research of that paradigm. And it has experts and it has involvement of clinical institutions. It has participation of ICMR laboratories. It has experts who are epidemiologists and so on. So that is where, for example, the discharge criteria, clinical care criteria have been developed. This is where we decided to give hydroxychloroquine to healthcare providers. This is the place where at least 12 treatment modalities have been systematically studied. This is where also we are looking at Ayushman products, Ayurveda products, to be taken to research and to therapeutic domain. So this is a science group, but largely clinico-epidemiological group. Then there's another structure for science, which is on vaccine and SNT work. And that is a mechanism where it is the principal secretary, principal scientific advisor, and I co-chair that. In NTF ICMR, I chair, and here we are two co-chairs, one representing science organizations and one the policy side. And this science and technology task force is banned science organization. So it is DST, DBT, Atomic Energy, Defense Research Organization, DBT, and CISR. So it is a conglomerate of all the science agencies, including ICMR. And this is where the thrust for vaccines, thrust for new medicines, thrust for diagnostics, thrust for PPE, these disinfection chambers, washing N95 masks. So all the technologies are being looked at by different verticals, different organizations, but they're all brought together as helping each other and also promoting each other. This is also the forum where we are reaching out to the startups for the innovation architecture of India. And in a systematic way, the startup ideas are filtered and then taken for further consideration. We get them connected to funding resources, to laboratories, to industry, and so on and so forth. So these are three: science and technology, clinical, technical, verticals that have been created. Then, of course, individual institutions are working together. One of the outputs of this kind of a work is also how we should share the clinical samples and virological samples across laboratories. Say a virus sample is needed by a certain laboratory for making a vaccine candidate, so how is it to be shared? The guidelines have been created. If a researcher needs blood samples from clinical patients, what are the guidelines to follow? This is being done, and now we're looking at how to use the PM CARES fund for vaccine development. We're looking at how to facilitate the industry to come out with the vaccine pathways, whether they are doing their own or they are doing it in collaboration with others. So there is a lot of macro level work that's being done, and this is the broad paradigm, and there is a very strong connect with the state governments, and that reach out is very, very critical and very effectively being done.
So wonderful, sir. I think you have maintained a lot of coordination. I can see a lot of parallel things going on simultaneously. So similar to this question is, every day, everybody is amused that what will happen now, because the guidelines are changing almost every day, and every day, then whenever there is a new lockdown, so everybody sees what will happen now. So how do you maintain this balancing act between science on one side and economy related priorities on other side, and while ensuring that there is no panic among the population?
Well, as I said, this is perhaps the most important task and responsibility, and a critical area to be mindful of for the entire government and entire society. Because you're trying to balance control of a pandemic about which we do not know many things or most things in a way. There is no rule book, there is no previous experience, there is no SOP that should be followed. every country at the macro level is doing things for the first time. Unprecedented things have happened. This is only, an animal in the zoo, which is only 100 odd days old. We had not, this thing did not exist on the planet, at least as we know it. So it is totally new, and all countries are grappling with the question that you raised. How do you make sure that you suppress the chain of transmission, and at the same time you do make sure that the life goes on?
Yeah.
The point is to be able to balance saving lives
Yeah.
with saving activities and normal life, and it's a difficult balance because the point is that in this battle we do not have a drug which changes my susceptibility. We don't have a vaccine which changes the susceptibility of individuals. So everybody is susceptible to this virus because practically everybody has no innate immunity or the acquired immunity to protect against the onslaught. So virus is moving in a
Yeah.
very safe environment, so to say, and has so many people to infect.
Mm.
And how the epidemic pans out depends on what we do together.
Yeah.
So virus is doing its job.
Mm.
Virus knows its maths, its capabilities,
Mm.
and it will catch susceptible people once it goes close to them. But the shape of the trajectory and the shape of the pandemic and the size of the pandemic is not the will of the virus alone.
Mm.
We create the headwinds to stop the virus by doing things even without a drug and without a
Yeah.
vaccine.
Yeah.
And we do that through the best practices that you're discussing today, whether these best practices are distancing,
Mm.
mask, hygiene, or whether using, the Arogya Setu app to
Yeah.
be mindful and to
Yeah.
behave in a certain way, or to look after old people,
Mm.
or to care seek when the time comes, or to contain. So all the actions that we do
Absolutely.
from what is available to us as tax practices
Yeah.
is what decides how much we are able to stop the virus
Exactly.
and create headwinds so that it doesn't go forward.
Mm.
And so therefore, there is no way to know how exactly this whole pandemic will pan out
Mm.
because virus part is predictable on many models. But
Mm.
what we do collectively, 1,300 million of us, 1.3 billion of us,
Mm.
cannot be factored into a mathematical equation.
Mm.
It is us as individuals, as families, communities, as society, as state, as a city, that
True.
would determine where it goes. So there are imponderables.
True, sir.
But one thing is very clear that the virus is there to stay.
Yeah.
We do know the vaccine is away at least more than a year, if not longer, if at all it comes, and so on. So we have to accept this. It has created a havoc in the country, on the world, in more than one way, most unexpected.
Yeah.
But that's the way forward, and that has worked in different states. Many states have been able to flatten the curve.
Yeah.
Punjab is one of them. Kerala was one. Now they have a little blip, but they were successful. And so there are others also quite close to
Yeah.
that in a way. And overall, also, we have slowed down the transmission from doubling every 4 days or less
Yeah.
to 14 days or more.
Yeah.
So there are achievements that have accrued to us as a nation by creating headwinds to the transmission and the flow and the journey of the virus.
Yeah.
And we will continue to do so even as we prepare our health system.
Yeah. So, sir, similar question in continuation with this, because you have maintained a very nice balanced act, and despite maintaining a good balanced act, India, has fared far better than many other countries across the globe. So, whom do you want to give credit to in such situation?
Well, credit goes to the Honorable Prime Minister first and foremost, but the credit also immediately goes to the people of India as a nation. It
Yeah.
is the country as a whole which has um, followed the decisions that were taken,
Yeah.
welcomed them,
Yeah.
accepted the cost that occurred.
Yeah.
Unfortunately, that cost to the economy is there, human cost has been there.
Yeah.
But yes, the country has stood clearly together And there was a consensus, there is a consensus, there continues to be a consensus that this calibrated response was the best way forward, coming at a time when we were not having many deaths. So we could save lives, unlike other people who took such steps when lives are already costed
Yeah.
much more.
Yeah.
So it was strategic decision. People welcomed it. All the state governments welcomed it. All the chief ministers welcomed it. They have stood by the strategy. And now when we are easing out this in a systematic way, we are more ready than ever.
Yeah.
We have demonstrated our behavior change more than ever. Our science is better prepared now than before.
Yeah.
And our resolve is there ever before.
Yeah.
And we will face it and have a strategy in which there will be containment of relatively smaller areas, and
Yeah.
we hope to normalize the life outside these areas to the best possible extent in a
Yeah.
gradual, calibrated way.
So hope to get better, hope to neutralize it, hope to, I think we have a lot of hopes, and it can be believed because we have done all the good for last 100 days. So sir, another question which I have asked also to Dr. Randeep is about every stakeholder, whether it is AIMS, ICMR, NCDC, or even different states, may have contrasting opinions about lockdown, about curfew, about different aspects of COVID management. You being at the hot seat, how do you ensure that flexible approach while consolidating all the views of different people and convince them?
The Honorable Prime Minister has made sure that his decisions are well thought out, well planned. He's made sure that there is a total and full engagement with the state. So there is a consensus on the approach that has been taken so far. There is no doubt. It is a unanimous and full consensual approach through which the country has moved forward. Uh, and now that we are moving to the next phase
Yeah.
of this battle, there is a consensus that it's time to open up, time to face it, time to respond through the health system if required to look after exposed patients, sick patients. And if need be, the strategy will be further refined.
Yeah.
So I would say the strategy so far is truly national in character, based on consensus, based on a collective judgment
Yeah.
of its being relevant to the existing circumstances.
Yeah.
And this is how we will move forward as a nation.
Good, sir. So a final question is, like, we have decision makers of 161 iTech Nation who are listening to this program, and they want to know two things. One is, how do we anticipate the future? So everybody is looking after the future, what the future is. And second is, what one advice you like to give to them so as to contain the coronavirus in their country?
Well, nobody knows the future. I wish the future was known. Nobody predicted this pandemic. Nobody thought this will be so devastating. So I think we should not pretend that we know the future. We can say science helps us to peer into what may look like future. These models are available which do indicate certain direction, but none of the model is perfect at all, and there are huge variations in any predictions that anybody has made. There's a wide range of uncertainty. So I don't think future in that sense is predictable. But one thing is predictable, that this virus will live with us for some time, if not for a very long time or forever, perhaps. What is very clear is that there is a journey of at least a few months, if not longer, of intense fight with the virus, kind of things that we were discussing earlier. Uh, and that is for sure certain. It has changed our lives, that is for sure. We will have to continue exhibiting the new normal, that is for sure. But beyond that, it is not easy to predict, because we don't know the disease. And as I said, the most unknown is how good our collective response is, because that determines the trajectory and that determines the damage.
Yeah.
And we have no way to put that into an equation. And therefore, I would not predict future. My only request on this global forum will be that we should use opportunity to learn together, to share experiences together, share science and technology products together. We should look at how we can be most helpful to the most vulnerable, to the most poorest of the poor in this whole crisis. We are responsible to make sure that the damage is minimum and the poor people suffer the very least.
Yeah.
And our collective endeavor for solutions, which are drug solutions, diagnostic solutions, as well as vaccine solutions, should be attempted together and should be shared together at an affordable cost. And that is how we as humanity can face this unforeseen, unprecedented challenge to all of us. Thank you.
So sharing is the key, and because the virus know no boundaries, so that is the message. So thank you very much, sir. Thank you for joining despite your busy schedule, and I hope that we'll keep on listening from you, and India will really fight this battle head on.
Thank you
Thank
so much.